I'm not hungry, that don't look good, and I don't feel good. Those are some of the responses you might get from someone with an eating disorder. Many people fail to realize that eating disorders can cause people to die. Many times people do not recognize if people have an eating disorder until it becomes severe. There are three main types of eating disorders: anorexia, binge, and bulimia. Any of the three main eating disorders can cause death if not helped. There are many things that people need to know about eating disorders, such as what exactly is an eating disorder? What are some symptoms of eating disorders? Statistics on eating disorders. Who is usually affected by eating disorders? How people are affected by eating disorders, and how to help someone with an eating disorder. What exactly is an eating disorder? An eating disorder is a psychological disorder in which a person has a disoriented view of their body, and no matter how small a person gets, they still think they are not little enough. The three main types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating. Anorexia nervosa is when a person tries an extreme diet or may starve themselves completely. People with anorexia nervosa may even exercise excessively in order to lose weight, even when a person is not eating anything. Bulimia nervosa is when a person will purge or find a way to get rid of the food that they may or may have not eaten in order to lose weight. Binge eating is where a person will eat a small or a large amount of food over a certain length of time. They will eat more and more and keep consuming food. While with binge eating, people may also eat too much and just lose control of their eating and end up overweight. Eating disorders can happen to anyone if they have an extreme desire to lose weight. Many times people do not realize that someone has an eating disorder because the person with the eating disorder may not know themselves, or they may be trying to hide it. Some ways to tell if someone may have anorexia is if the person refuses to eat, excessive exercise, an intense fear of gaining weight, and extreme thinness in some cases. A few ways to tell if a person may have bulimia is if they induce vomiting, they have laxative use, or damaged or corroded teeth and gums, dehydration, and going to the bathroom during and after meals. Some things you may notice with a person with binge eating is excessive eating, guilt after eating, uncontrollable eating, and fast eating during binge episodes. People should understand the symptoms in order to tell if someone around them may have one. While many times in eating disorders are not treated, they become severe and can cause serious effects on the person's body. Some long-term effects from an eating disorder may be low blood pressure, depression, osteoporosis, infertility, and in women their menstruation cycle may become irregular. Unfortunately, if the eating disorder becomes severe enough, the person could possibly die or come very close to dying, or their organs could even start to fail. These effects, if they do not kill the person will have to live with the effects for the rest of their lives. If people knew just how much people with eating disorders are affected by them, then they would never even start. 8 million people alone in the United States have an eating disorder. 1 in every 200 women in the United States have some type of eating disorder. That means if you take 200 random women in the United States, then 1 of them would have an eating disorder. According to the South Carolina Department of Mental Health, eating disorder have the highest mortality rate of any other mental disorder, including depression, with 5 to 10% of people dying within 10 years of getting the disorder. Then 18 to 20% in 20 years, and only 30 or 40% of the people with eating disorders ever recover and get back to normal. This is because of treatment. Most people do not want to go through treatment because it is fairly expensive. It ranges between $5,000 to $2,000 per day. $500 to $2,000 per day. While the cost for treatment in a month is about $30,000, and most people have to stay in treatment around 6 months. It is sad to see that eating disorders are the third most chronic illness in teenagers. There are teenagers that start as young as 11 years old with eating disorders. While we think that women and children may have eating disorders, there is also proof that men have eating disorders. There is 15% of men that suffer from eating disorders. People should know how to help someone with an eating disorder. If a person thinks someone has an eating disorder, you need to talk to the other person about it. The person with the eating disorder may try to hide it, but they need someone there for them. There are usually many myths about people with eating disorders that they have to be small. That is not necessarily true. And only young people are affected by eating disorders. This is not true at all, although this could be fatal. If a person is afraid to talk to someone they think may have an eating disorder, just be very sincere because it is such a delicate subject. If it is a friend, a good way to talk to them would be about being sincere, showing concern about the subject. Avoid guilt trips. Do not try to tell them that they can and cannot do it. And do not mention anything to do with fat. While if it is towards a child, people need to look at a way to look up towards food. Set limits. Stay firm with the subject. Do not scare or threaten the child in any way. And promote positive self-esteem. Always be a support to someone that may have an eating disorder. Eating disorders are a very serious issue and many people just tend to overlook it. People think it is just a phase someone's going through or it's just a healthy diet, but it can become far worse. Eating disorders are serious and can kill, and the person can even die. The person may be affected in many different ways for the rest of their life. These people may not be able to do what most people can. These people may not even be able to gain weight at all. They may stay underweight or overweight for the rest of their lives. Some people do not realize the dangers. They may purge one time and it may turn into a habit. They may refuse to eat one meal and then choose not to eat for days and days. And other people may choose to eat and eat and eat and eat and just feel okay.